Welcome to the image analysis and critique of the humerus. Let's get started with the AP projection. Image analysis guidelines for the AP projection of the humerus state that the distal humerus, the medial and lateral humeral epicondyles are to be demonstrated in profile, and 1/8 of the radial head should superimpose the ulna. In the proximal humerus, the greater tubercle is demonstrated in profile laterally. The humeral head is demonstrated in profile medially. The vertical cortical margin of the lesser tubercle is visible about halfway between the greater tubercle and humeral head. The humeral midpoint is at the center of the exposure field, and the shoulder and elbow joints and lateral humeral soft tissue are all included within the exposure field. I have included the projection image analysis guidelines in this presentation as well. So let's discuss rotation in terms of the AP humerus. When the humeral epicondyles and the greater tuberosity are not demonstrated in profile, you want to measure the amount of radial head superimposition that is on the ulna to determine how the patient should be repositioned. If less than 1/8 of the radial head superimposes the ulna, the humerus has been externally rotated more than needed to obtain an AP projection. So in the first image, the patient is in external rotation. That radial head is not superimposing the ulna like it should be. An internal humeral rotation, that is where there is more than 1/8 of the radial head superimposing the ulna. The greater tubercle will not be in profile laterally. The humerus has not actually been externally rotated enough to bring those humeral condyles parallel with the IR. So in the second projection, you can see the example of internal rotation. The greater tubercle is not in profile, and that radial ulnar relationship there is internally rotated and superimposing each other. We're going to move on to the lateral projection. We're going to talk about the lateral-medial projection and the medial-lateral. Typically, for the lateral projection, we're going to do a lateral-medial projection. However, we are going to discuss the medial-lateral. Image analysis guidelines for the lateral projection state for the proximal humerus, the lesser tubercle is demonstrated in profile medially. The humeral head and greater tubercle are superimposed. For the distal humerus, the anterior surfaces of the capitulum and medial trochlea are nearly aligned. The shoulder and elbow joints and the lateral humeral soft tissues are all included within the exposure field. I have included that image analysis guidelines for you. Let's take a look at an image analysis for the medial-lateral lateral projection. As you can see in this image, the patient has some artifact here that we should remove prior to imaging the patient. Secondly, we have a lot of soft tissue overlay in this projection. This causes increased brightness and lowers the contrast resolution at the proximal head of the humerus. In order to correct this imaging error, we need to rotate that patient's torso away from the proximal humerus. Remember, into a true PA projection. We're taking this mediolateral, so therefore we need to make sure that we get that soft tissue away from that proximal humerus. Let's talk about the lateral projection, lateral medial specifically for the humerus. Recall the image analysis guidelines again. And looking at this image, let's analyze it. We can tell that there is something not going on here correctly. I mean, we do not have a true lateral elbow and humerus. We cannot see the lesser tubercle in profile like we should. Your capitulum of the capitulum is posterior to the medial trochlea. Therefore, we do not have this arm internally rotated enough to position the humeral epicondyles perpendicular with the IR. In order to correct this positioning error, we need to place the distal forearm on the abdomen and rest it on the IR. Internally, we're going to internally rotate that arm until that humeral epicondyles are positioned perpendicular with the IR so that we can get that true lateral projection we want to see in a lateral humerus. This concludes our image analysis of the humerus. If there's any questions, please feel free to reach out. And thank you for participating in the image analysis.